Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of hepatocellular carcinoma. So, how is a patient with hepatocellular carcinoma treated? Right. Hepatocellular carcinoma, obviously, because it is a cancer, we should do hepatic resection is the first line of treatment for hepatocellular carcinoma. Okay. First line treatment is hepatic resection, and we should preserve the remaining liver functions. We should make sure that the remaining liver is preserved properly. Then then we should also reserve for future liver transplantation if there is either deterioration of liver function or if there is recurrence. Then you should always think for transplanting the patient. Okay, now one important thing is you should see what are the prerequisites for resection. That is, when do you allow the patient to resect? So what are the prerequisites for hepatic resection? Hepatic resection in hepatocellular carcinoma. In hepatocellular carcinoma, you can do a surgery if the patient has, number one, normal bilirubin concentration, and if the patient has no portal hypertension. If the patient has normal bilirubin concentration and no portal hypertension, only then you should go through the hepatic resection. Then, second, if hepatic resection is not possible, then you can give the patient percutaneous ablation. Okay, this percutaneous ablation, when is it done? What are the indications of percutaneous ablation? Percutaneous ablation is done in patient with advanced disease, that is, if the patient has large hepatocellular carcinoma and multifocal hepatocellular carcinoma which cannot be resectable, then uh, we can do the percutaneous ablation. Actually, 1 minute, sorry. Right, what are the indications of percutaneous ablation? If the individual. Okay, one thing. What are the indications of percutaneous ablation? Percutaneous ablation is done if bilirubin is increased and if the patient has portal hypertension is present. In such cases, we cannot, if no surgery is, uh, if surgery cannot be done. Okay, or surgery is contraindicated. Yes, surgery is not done if there is increased bilirubin and portal hypertension is positive. In such cases, we should do percutaneous ablation. If the patient has a more advanced disease with large multifocal hepatocellular carcinoma, then we do a transarterial chemoembolization. Okay, so this is actually a palliative procedure because here the patient has large and multifocal hepatocellular carcinoma. It is difficult to resect the patient, and even ablation might not give proper result. So we have to do a palliation therapy. So only one, the best palliative approach which is available for hepatocellular carcinoma is uh, transarterial chemoembolization is the best palliative approach in the hepatocellular carcinoma. Okay. Next, if the resection is not possible due to a poor liver function, if the patient has poor liver function, and in such cases, if resection is not possible, then you should see the Millen's criteria. Okay, and if Millen's criteria is met, then we can do the transplantation. Liver transplantation is the treatment of choice in this case. Now the question is, what is Millen's criteria? If there is only one node, if there is one node of less than 5 centimeters, or if there are two or more nodes of less than 3 centimeters, or if there is no vascular invasion or extrahepatic spread. In such cases, if all these are positive, then a liver transplantation is done. That is, if there is only one nodule less than 5 centimeters, if there are two or three nodules all less than 3 centimeters, if there is no gross vascular invasion or extrahepatic spread, in such cases, liver transplantation is indicated in the patient.
Thank you and thank you for watching.